My name is Alexander Stremitzer, and I'm the Professor for Law, Economics and Business at ETH Zurich. In September 2020, the Journal of Nuclear Medicine published a study that I co-authored with Kevin Tabia and Aileen Nielsen, entitled "When Does Physician Use of AI Increase Liability?" Let me briefly summarize the results of our study. New AI tools can assist physicians in treatment recommendations and diagnostics. In our study, we asked the following question: if physicians rely on AI tools and things go wrong, how likely are they going to be found legally liable? There are two considerations. On the one hand, medical malpractice liability requires a deviation from the due care standard, and this standard is traditionally met if the physician exercised standard care. Physicians might therefore expose themselves to increased liability when accepting non-standard AI advice. On the other hand, accepting AI advice might increasingly be viewed as the new standard, in which case the physician would expose herself to liability when rejecting AI advice. It turns out that there is an empirical way to study what likely matters to jurors. In the US, jurors decide when a physician is liable. Jurors are lay people. We therefore studied lay people's attitudes about physicians who use AI by running an experiment on a representative sample of 2,000 US adults. We find that these potential jurors are surprisingly favorable in their assessment of physicians using AI diagnostic tools. We present participants with different versions of a scenario in which a physician had to decide what dosage of a chemotherapy drug to give to a patient. In this decision, the physician was supported by an AI tool. There were 4 versions of the scenario. The AI tool recommended either a standard or a non-standard treatment, and the physician either accepted or rejected that recommendation. In all scenarios, the decision turned out to be wrong, and the patient was harmed. We found that participants evaluated the physician more favorably when the physician accepted the AI advice. This was particularly strong if the physician followed AI advice to provide standard care. But the effect was also present when the physician followed AI advice to provide non-standard care. This finding suggests that the threat of physicians' legal liability for accepting AI recommendations may be smaller than is commonly thought.